On 29 September, we celebrate World Heart Day, which is marked to raise awareness and inform people about cardiovascular disease, which include heart diseases and stroke. You will be shocked to know that this is the leading cause of deaths around the world, as it claims millions of lives each year. Hello everyone, my name is Shrishti, and to know more about our heart's health, let's speak to Dr. Praveen Chandra, who is a leading Indian cardiologist. Thank you, sir, for giving your precious time to WION. So my first question here is, what do you have to say about this alarming data in India and also the world?
Know already, and many people are now getting aware that the biggest killer of mankind today is heart and cardiovascular diseases. Bigger than any disease, bigger than cancer, bigger than any war. So that means we have to fight this problem at a war footing. And how do we do that? So there are many ways to handle this problem, to prevent this problem. And of course, prevention is the first step. For preventing heart disease, the steps we have to take is lifestyle modification is the first step. And in lifestyle, the most important things are regular physical activity, balanced food, and reducing mental stress, controlling blood pressure, controlling your cholesterol levels, and of course, if those people who have family history of heart problem, they have to be more aware and they have to get regular checkups done. And finally, stoppage of smoking. Smoking is another important factor which leads to heart and cardiovascular diseases. So to prevent this disease, this is the cheapest and the first step we have to take to avoid any heart problems.
So my next question is about the recent rise in deaths in relatively younger people. We have seen cases in celebrities especially. What do you have to say on that?
So basically, as I was telling that, cardiovascular diseases or heart diseases in general are the commonest cause of death. So in young and in old also. So basically, people have to understand that we have to start looking at preventing ourselves from developing heart disease from younger age. Earlier, people thought that it only happens after the age of 60 years, 65 years, and it is okay, you can do whatever you want to do. But actually, it is not the truth. And since we have access to so much media, we have access to so much information, that is why we are coming to know of this problem. It was happening earlier also. It is happening in general population also. And in our country and in the Asian subcontinent, the disease is hitting harder and in younger population, which means that people above the age of 30 years, 35 years have to get a checkup done on a very regular basis. And this checkup doesn't need to be very extensive checkup, basic checkup. Basic checkup means checking your blood pressure, checking your blood test, which is very simple, 300-400 rupees cholesterol test, and then also looking at in case somebody is developing sugar, because diabetes is one of the commonest cause of heart problems apart from the other causes. Then controlling lifestyle. So all these things, if someone does, then there is a very good chance that you are able to avoid 80% of heart attacks and 80% of heart problems without spending any money. So this is the main message I want to give as far as the prevention is concerned. And then of course, once the disease happens, we have to recognize early, etc.
Sir, I would also like to ask this question that recent deaths are also connected to gymming. So would you say that gymming is bad for our health?
It is not bad. Rigorous physical activity or very high intensity physical exercise should only be done by those people where we know that everything is okay. Not everybody can just rush and push to the rigorous physical activities or harsh gymming activities. So if somebody is sure that yes, everything is fine, the blood pressure is good, and there is no problem of diabetes, etc., so then he can go ahead with these activities. Otherwise, cardiac checkup has to be done, and one has to know whether the heart can sustain this kind of physical activity or not. And for this, we do a very simple test known as a treadmill test. A treadmill test tells us what is the endurance capacity of your body and your heart to take up a level of physical activity.
Sir, in the past 2 years, we have seen people more focused on COVID and its related impacts. So, do you think people have been avoiding their signs which are causing heart issues? Do you think COVID lockdowns have caused a surge in heart ailments? What do you have to say on this?
Because heart disease was going on. It was not stopped during the COVID times. And while people were not able to get the test done, they were not able to go to the doctor, and that is why the disease was kind of ignored, either knowingly or unknowingly, and that is why these patients were left at home without proper treatment, without proper investigations, and that is why more people actually started developing more serious heart problems, and they actually succumbed to those problems. And that is why I must say that COVID actually did not cause so much problem. It was basically the effect of COVID that the patients were not treated well for their heart problems.